first interviewed to be a part of the program, I told the admissions committee that I wanted to look at the intersection of chronic illness and trauma, because I'm very passionate about trauma work as well. And I was sort of new to the clinic, so I didn't really know how they intersected and then what to do about it. So I was able to interview 7 adult patients with cystic fibrosis from around the country. I interviewed them about their medical trauma experiences. And my guess was that they were all going to endorse some trauma symptoms, and they all did. And then from there, I was able to ask them what helped. What did you do to deal with this? I want them to understand that even though they're going to their quarterly visits that are recommended because of their health needs, just that alone can be traumatic. Walking into the hospital or the clinic where you've been poked a million times, or you've been admitted, or you've gotten bad news, that can be traumatic, and all of those things are triggers. So I want them to understand that even though you're just doing your job, we're just doing what we need to do, we need to be very sensitive to how the patients and their caregivers, their family members, are receiving these health interactions. And one of the current recommendations from the foundation is that we have a medical provider, a dietitian, a social worker, all of these components, teammates on the team, but a mental health provider and a child life specialist are just maybe recommended. They're not required. To be accredited by the foundation, you have to have these other positions, but what I learned from my research is these other 2 positions are critical, and I would like to recommend that they be required for unaccredited centers. But every person I talked to said that either their child life specialist or their clinical therapist or psychologist was critical to their healing process, and those teammates walking alongside them helped with prevention. And so one patient told me that he had a very difficult medical interaction, but his child life specialist was right there next to him, and that made it easier. So what I project is that we will be able to prevent these medical traumas, because it's almost inevitable that they're going to experience medical trauma, but we can make it less if we have these team members whose goal is to just be with the patient, and that will help them have less of a traumatic experience with their medical interactions.